What will the second wave of COVID-19 look like in Quebec? And also, what's the latest research on how COVID spreads and how much of an issue, how much of a problem might poor ventilation become this fall? I'm Annie Demelt for the McGill University Health Centre's MUHC TV, and I'm joined by Dr. Vinh, who is an infectious disease specialist for the MUHC. First of all, Dr. Vinh, tell us, what do you think a second wave is going to look like for you? Is it more of a matter of when rather than if a second wave will hit?
We anticipate a second wave. And what that means is that we will see an increase in the number of cases. But how high of a wave and what are the consequences of that wave, we still have control over, I think, at this point. What are going to be the consequences of that second wave? Will we see just an increase in cases in the community? Will we see an increase in the number of hospitalizations? Will we see an increase in the number of severe cases that require intensive care? It's especially the last two components that we're particularly worried about as physicians.
What are you seeing elsewhere where they're seeing a second wave? I'm thinking of Spain, and I was just seeing that the numbers there seem to indicate for now at this point that yes, there is a huge increase in the number of cases the second time around, but not necessarily in terms of people getting very sick and hospitalizations. Is that something you're seeing elsewhere as well? Is there a cause to be optimistic at all?
Oh, absolutely. So in Spain, if what we're seeing now is really the start of a second wave in Spain, what we are seeing is some differences from the first wave in Spain. Notably, who is getting affected. So in the first wave, as we had seen also here in Quebec, there were primarily the older populations who were not only getting infected, but also needing hospitalizations or even those who were dying. So the bulk of the death rate was in the elderly, both in Spain, other parts of the world, as well as here in Quebec and Montreal specifically. What we're seeing now in this is that there's an increase in cases, but particularly of people who are young. Those individuals tend to get less sick, so there may be an increase in the number of cases, but not necessarily an increase in the hospitalization or in the ICU care.
Let me ask you what the latest research is when it comes to how COVID spreads.
What we know is that the major route of transmission for the most common settings is by respiratory droplets. These relatively large secretions that come out of our mouths and nose when we speak or cough or sneeze that can only go about 2 meters for the most part. There are also smaller, finer particles that can come out, and those can also travel a little bit farther than 2 meters. And in most situations where you have, for example, open ventilation, that's not a major issue. But in closed spaces, as we've seen, for example, in a case that involved multiple people getting infected in a restaurant in Korea, or in some of the ventilation rooms that in schools, for example, we may have poor ventilation, or in other areas which have poor ventilation, what we can see is that these smaller particles do accumulate over time and have enough virus in them that could lead to infection of other people in that room. So this sort of aerosol transmission rather than droplet transmission can become an important mode of transmission in certain circumstances. But the majority of the transmission seems to be droplets.
How much do you think then that poor ventilation, how much of an issue do you think it might become?
This droplet aerosol transmission, we actually do see that with flu virus and actually with other cold viruses. It's just that for the most part, most people don't get very sick, for example, with a cold. So COVID is a little bit unique from that perspective. But in terms of the transmission, it's about the same. Simple, basic rules is natural ventilation. If you can do things outdoors, those tend to be associated with lower risk for transmissions. If you can keep windows open so that there's drafts of air coming in, even if you don't feel it, there's still drafts of air coming in, those are going to minimize your risk for infections. So those types of basic measures are going to be very important.
And of course, social distancing being the biggest one.
Absolutely.